We do not always appreciate the importance of our health until we lose it. When we are told that nothing can be done to heal us, no matter how much money we have, everything that seems so important before now starts to lose its value. We experience pain, desperation, and loneliness in the presence of others. Then we acknowledge that healing is a gift that goes beyond medicine, that there are other options out there that may help us, and that there is a higher power that controls the distribution of this gift. As a result, we hesitantly and somewhat reluctantly begin to explore these other avenues. To our great surprise, we discover the secrets of the universe through alternative medicine. We experience and respect the generosity of divinity through various health modalities. Our faith is restored, our health improves, and life begins to make sense again. Health is a basic human right. And healing is a gift that is given to us by God through a variety of channels, including doctors and other alternative practitioners. How is it that until now we did not know that there was so much on offer? That doesn't really matter, for now we are being given the chance to know.
Welcome to this episode. We were in Gauteng this past week and we had a productive week there. The people there are very friendly and they appreciated a lot our visits to the city. A very big thank you to all the people of Gauteng. It is not an easy task to decide what topic to cover in each show because there is so much information around health issues which need coverage. In every family, no matter what the race, social status, language or culture, food and health are among the most common and universal. What sometimes guides me in the topic that I must choose is the type of illness that I find in most people and which people who visit our clinic do not know a lot about. So our topic this week will be on sarcoma. Enjoy the show.
Have you ever wondered what makes one person have such flabby muscles while the other is so well toned? Ever wondered also what causes such lumps in people's skin or bone pain and deformity that never responds to any treatment? You may have to look at sarcoma. There are many other causes for such conditions, but sarcoma is top on the list. What is sarcoma? It is a tissue cancer. What is a tissue? Let us take a look at that. The body is made up of billions of different types of cells, which follow a structured program of production right up to death. Cells of a similar type group together and form what we call tissues, which then perform a common function. For instance, a connective tissue holds the framework or structure together. Epithelial tissues protect us from losing moisture, and the list goes on. These tissues form part of our body systems. Things do go wrong sometimes in these systems, and they end up affecting, among other things, these tissues. As there are different types of tissues and their functions, the disturbance in the body's systems, and the type of illness presenting will depend on what type of tissue affected. Sarcoma, therefore, is a type of cancer which targets soft tissue, bone tissue, and gastric tissue. Even though there are only 3 main categories, there are many types that fall under these categories. So watch what you eat and know what your body is designed for, as if you miss the point, you may very well end up with sarcoma. Are we saying that sarcoma is caused by diet? Yes, we are. We are indeed.
Welcome. This is another episode of the Dr. Alternative Show. I'm Carol, your medical intuitive, and presenter is Tembi.
Hello. Hello.
Good. Hi. Looking forward to another exciting show again.
Yes, we are.
Awesome.
Yes,
what are we going to do today?
Yeah. Today we're covering another unknown subject, if I may put it that way. Why am I saying that? Because I'm looking at the number of people that I've treated and some that I'm still treating who have suffered for a long time before they discovered what is wrong with them. So today we're talking about sarcoma.
Okay.
Yeah.
Tembi, what is sarcoma and what causes it? I know you've been treating a lot of it lately, especially while you've been away as well. Mm-hmm. What is sarcoma? I think people don't really know this word. It's not a familiar word. We don't hear too often.
Yeah.
So what is it and what is the cause of this sarcoma?
Look, sarcoma is also cancer. I sometimes shudder talking about or labeling any condition cancer because of the fear that it carries and that it causes other people, many people to have. But sarcoma is a tissue cancer. It's some form of cancer, but which attacks the tissues. All right. We'll talk more about it as we go down. But to come to what causes it, okay? Or maybe before I even get to what causes it, if you've looked at the insert that we did earlier, where we tried to explain so that people can understand, because at some stage you find that people don't even understand what a tissue is.
Sure.
Yeah. Which is understandable because the body is so complex, and so some of the areas are actually quite unknown to us. So sarcoma attacks the soft tissue. It's a cancer that attacks the soft tissue. It will attack the soft tissue. Mm-hmm. It will attack the bone tissues, because remember, bones have got tissues.
Sure.
Sometimes a person walks in and says, and you say to her, you've got a spinal cord scleroderma, and they say, no, they say my cartilage, or my vertebrates are finished or are touching. And meanwhile, it's a tissue problem. It's not a bone problem. It's the tissue of the bone.
Okay.
So bones have got tissues as well. And so sarcoma does attack bone tissues as well. But it may also attack the gastric, because remember, like we've always said, that the gastric area is the source of so many other illnesses. So even in sarcoma, it stands out as a category, because there are different categories of sarcoma, but they are put under the 3: the soft, the bone, and the gastric. So sarcoma is a tissue cancer, therefore, that attacks these following tissues that I've mentioned. Okay. But what causes it? When I was going through the literature, the conventional medical literature, just to see what do they know as the cause of sarcoma, the answer in various types of literature that I've consulted, the answer is it's unknown.
Wow.
The answer is unknown. But from the alternative perspective and from my personal experience, all the people that I have diagnosed and treated with sarcoma are deficient on aldolase A enzyme.
Oh, wow.
Now remember the aldolase enzyme, which most people have heard about for the first time from Health Haven.
Yes.
It's an enzyme that is it's not an invention or creation of Health Haven. It's an enzyme that exists, and that should have been known. It surprises me that there's so much less information that is known about it. But aldolase enzyme is in 3 forms. There's A, there's B, and there's C. I've talked a lot about aldolase B, which is stored in the liver.
Yes.
So most people, all the people that watch our show and who come to us, they know I've told them about the aldolase B deficiency actually affects the liver, but the aldolase enzyme it processes fructose. It converts fructose sugar into glucose so that it is converted into energy. But it is stored in the liver. That's now aldolase B. Aldolase A is stored in the muscles.
Oh, okay.
Okay. So aldolase A enzyme, therefore, is still part of the aldolase enzymes. As like I said, that it's one enzyme, but it's different types. In different categories. There's A, there's B, there's C. So aldolase A is stored in the muscles. So when you are deficient on aldolase A enzyme, you will have tissue-related illnesses.
Oh, wow.
And sarcoma, therefore, is a cancer that attacks your muscles and your tissues. So that is what causes it. So from what, what I'm saying this because while conventional says it's unknown, I'm actually giving them a cause for aldolase, for sarcoma. And I'm not just basing it on, theory.
Absolutely.
Like I've always said, I'm talking about cases that I have treated successfully.
Yes.
And others that I'm still treating. And all of them, the common denominator is aldolase A deficiency.
Wow.
Now, aldolase A, Carol, still processes fructose. Just like B, it's just that it's stored in the muscles, tissues and muscles. That's the only difference, but it also works on fructose. So if you have fructose, if you are deficient on aldolase enzyme, therefore you are fructose intolerant. Therefore, you must not have fruit. I go back to fruit
Period.
again. Go back to fruit again. So that is what causes aldolase enzyme on the basis of what I've worked on, which I can prove.
Sure.
That is what I've identified as the cause for sarcoma.
Thembi, having listened to all of that, why would you think that the medical fraternity are having such problems diagnosing sarcoma? After you telling me that the subject basically is almost, or the problem is unknown.
Yes. Because they don't know what causes it.
Absolutely.
And it's I actually like the fact that you're asking me this question because I just want to show even the conventional medical profession, but that the whole idea of our show and our manner of operation and our techniques and all that is for us to eventually find a way of working together. So I am interested in their way of doing things and in the information that they have regarding certain issues. And I'm trying to understand why are there so many problems in certain areas. Okay. So I have looked, like I gave you the answer earlier on that to them, the cause is unknown. Okay. But the reason why I think they battle to detect this and maybe other illnesses is because they have never looked at medical nutrition. Nutrition to them is just a by the way kind of thing. Conventional doesn't realize how huge that is actually the anchor of many illnesses. That is now nutrition is the anchor of many illnesses. So I'm not surprised therefore that they because like I say, from what I have experienced and from what I've worked with, like I said, the common denominator is aldolase A deficiency.
Sure.
And that is a dietary, that is a metabolic disorder, So, so therefore I would say maybe the reason why they don't know is because they've never looked at that. I mean, they've never looked at that. I remember once when I had a patient who had a serious seizure. The thing I've made a few reference to this little girl. When she was having a recurring episodes of seizures, and I said to the mother, ask them to test for enzyme deficiency. You know, and she said, she actually did go to her doctor, and she came back to me and she said, he wants to know how to go about it.
Oh, wow.
You know, because this is not the field that they even give too much or serious attention to.
Yeah.
So I had to, but I don't know also how their techniques would work in determining the enzyme deficiency. So I had to guide her on how to help the child, because the child was in hospital. So and the seizures were not abating. So they had put the child on the normal dosage of epileptic treatment, but they had now to put her on Valium.
Wow.
And she was still not responding to Valium. Valium is now adult dosage.
Absolutely.
You know?
Yeah.
So she was still not responding. And I said, this is what you should do, you know. But then after that, I had already given her the medication that she must take in order to control the seizures. But then I said, ask them to test for the enzyme deficiency, because that's where the problem was coming from. So what I'm getting at therefore is nutrition.
Yeah.
in conventional medicine is just...
Yeah. But we're just getting back again to, I mean, you think about Hippocrates again. Let food be our medicine and medicine be our food. So I think maybe conventional has deviated away from that.
Well, I don't know if they ever took it seriously. I really don't know if they ever took it seriously.
Yeah.
Because, I mean, look, Carol, this is not just affecting the professionals. This is affecting, because remember, the professionals are there to service the public.
Absolutely.
Now, if they disseminate information that is inadequate and insufficient, the people who take the flack are people on the ground, because look how difficult it is to make people understand. I mean, when we're doing our street survey and we asked, do you think diet cause mental illness? I mean, people would say, stress, yes, does cause mental, but diet, no ways.
But you know, Timmy, we always say about treating the whole body. I always refer to it as the vehicle.
Yes.
And I mean, I often mention it to patients and clients as well. If you've got a car, we know our cars take petrol. You cannot use diesel or aeroplane fuel in your car because it needs petrol of the right grade 95 or whatever we serve these days in our cars. And the oils need to be motor oil, not peanut butter oil or sunflower oil.
Of course.
So I think if we explain it like we do, people will start to understand that we have to use the correct food for
the
our
correct
bodies,
body,
like we do with our cars.
Exactly.
I mean, and people say, oh no, there's a 2-stroke engine, it must have oil with it. And the 4-stroke doesn't need oil with it. So our bodies, we know exactly what our bodies need.
You know, this story about fructose intolerance is a huge mind-shifting piece of information that people have come across, and they still find it really difficult to absorb. You find it sinks a little bit easier to people that are already experiencing some symptoms when they take fruit. Like, for instance, I'm thinking about one particular client of mine who said she used to do the smoothies, you know, and she said whenever she was doing a fruit smoothie, she would feel awful. She would feel something is just not right. But when she does the vegetable smoothie, she would feel fantastic. So somehow she picked up that there was something, but she didn't realize that there was anything wrong with fruit, except that maybe it was a reaction. Like most people would say, I've got allergies. So this story of fruit is still a new a piece of information that people are grappling with. And you'll find others will even say, if I should stop fruit, then what do I replace it with? Because the understanding is that from what we have been taught is that you cannot not have fruit. You cannot not have fruit. And yet, yes, people who are not deficient on the enzymes cannot not have fruit.
Sure.
But if you don't have that enzyme, then you shouldn't have fruit. There are no gray areas. It's either this or that, you know. So people are starting to understand because they can see the effects, and there is nothing that encourages me more than people who actually puts it to a test.
Absolutely.
And they stay away from fruit and they look and feel fantastic.
Absolutely.
I was just looking at one couple just in Gauteng when we were in Gauteng.
Yes.
I mean, that couple, they look fantastic, Carol.
Absolutely.
They are glowing. And they've stayed away from fruit. I mean, they are really glowing. In fact, one of them you did not even recognize because of the turnaround that he has had in
massive.
his appearance. Yeah.
Sammy, you keep talking about the fruit and we keep coming back to the fruit, but I can't believe how many serious illnesses there has to be something about fruit in the whole idea of the illness. And it has made such a huge difference to those people. In particular, I know exactly who you're speaking about. I thought the man was a movie star.
Yeah,
he looked so good.
Absolutely.
He was radiant. He looked absolutely stunning.
Yeah.
Just without the fruit.
Just changing the diet.
But he's actually quite amazing. He's remarkable.
Yeah.
Absolutely.
Yeah.
I think we've been indoctrinated since we're little to have fruit and veggies, and then I see so many people with the veggies that tend to add sugar when cooking their vegetables, which I think just defeats the whole object again, sweetening up the vegetables.
Exactly. Because we've acquired
the taste. Like you said about replacing, should they not have fruit, replace it with what?
Yeah. Replace it with what?
Absolutely.
Yeah. And yet if you look at this is what I normally say to people. I say, if you look at animals, herbivorous animals that are meant to eat herbs.
Yeah.
They don't miss out on meat. They don't touch herbs.
Yeah.
But carnivorous animals that are meant to eat meat, they don't touch herbs. And
Correct.
they don't miss out on anything.
And they listen to their bodies.
They listen to their bodies. They follow nature. We are the same. Why do we think we're different from nature? Because we're part of nature.
Absolutely. We need to listen more, I think.
We need to listen.
And know our bodies more.
Exactly.
Absolutely. Tembi, there's so many... Well, not so many. The three sarcomas that we were talking about.
Yes.
We've been seeing a lot of it lately, but the one that I really want you to actually elaborate a bit more on. People often think that it's arthritis. So I'd like to go more to the bone-related scenarios of sarcoma. Let us, because I think we've had a look at the footage earlier on.
Yeah.
Okay, in the show. So I would like to actually allow people who are suffering from arthritis to have a little bit of a bigger perspective on the whole scenario here. So maybe you can explain to us, because I actually thought a lot of it was so similar. The symptoms are so similar to arthritis.
Yes.
So maybe they need to look a bit deeper and to see that it possibly could be the bone sarcoma.
Yes.
Maybe you can elaborate on that a bit, because arthritis, especially in the elderly, it is so common, and it's such a painful condition for people to have. So maybe you can just explain a bit more about the bone-related sarcoma.
All right. Like I said earlier, Carol, bones have got tissues too. We must not just think the bone is a bone, is the hard...
it's hard to actually believe when you say tissue, but most of us think of bone, you think of a hard, brittle bone.
Of course, but that hard, brittle bone has got a tissue.
Okay.
Has got cells made up of cells.
Yeah.
Is made up of tissues.
Okay.
So it does have a tissue. It's got various tissues, got connective tissue. People would come and say, my back they say, like I said earlier on, that the vertebrates.
Yes, and the
cartilages. Meanwhile, it's the connective tissue. You find a person, people end up going for surgery, Carol. To say, no, we're going to remove a piece. They go for chiropractors because the backache is excruciating. Meanwhile, it's the connective tissue.
Timmy, so I just want to stop you right there. I know of so many cases personally where people have had their vertebra fused. They've had 3, 4, sometimes 5 back operations. And the sad part about it is they still have the same problems. So now what you're saying now,
of course,
it makes so much sense.
Of course.
To me.
I've stopped a few, I think a few people who were meant to go for shoulder surgery. Because they say because the person feels so much pain.
Wow.
You know, I remember one lady, when she came, when we had fixed it, because she was told by a friend that, man, because she had already decided that she was going to go for a shoulder, surgery. And she came here and it was a clot.
Oh, my word.
It was a huge clot that was exerting pressure. So the pain, and she could not even lift the arm. So she would have gone for an operation, which probably could have killed her. Why? Because that clot, if they missed the clot, could have moved, and caused a thrombosis, heart or whatever, So I said to her, this is a clot. There's nothing wrong with the bone. This is a clot, and I'm going to melt that clot, and I want you to come back to me. When she came back to me, she was dancing to show that the arm is back to its normality. So what I'm saying therefore is, coming back to bone sarcoma, there are so many people who are suffering and who are receiving treatment for arthritis, and yet it's bone sarcoma.
Oh, word.
Remember, bone-related conditions, there are various of them. Arthritis is one of them.
Sure.
Whether it's osteo or rheumatoid, but there are the connective tissue. The scleroderma is another a condition that messes up the bones if you've got the bone scleroderma, and it will cause the deformity like arthritis would, and
also
particularly rheumatoid. Rheumatoid
growths.
Causes that.
Absolutely.
But lymphoma also messes up the bones. I was just saying to two ladies who are related who came to me. Both had bone related conditions. The other one had sarcoma, and the other had lymphoma. So, and I explained to them, and I was even saying to the one that had lymphoma, and I said, do you sometimes, besides the fact that you've got joints, do you sometimes feel pain inside the bone?
Yes, we've
She
heard this.
says all the time, it's burning. It's because lymphoma is a bone marrow problem. So you will feel that pain. Not all of them, but when it hits the bones, you'll feel. But so I said to them, when I gave you the treatment, because I'm going to work out a treatment for them, I said, you will find that your treatment is going to be completely different.
Exactly.
Because I will be treating you for bone sarcoma, and I will be treating you for lymphoma.
Okay.
So you can't say if you've run out of a medication and say, my sister, can I have a little bit from what you have? Because
not going to work.
Different, even though you are presenting similar symptoms, and you both have deformity, but the causes are
different.
Completely different. So bone sarcoma, therefore, it is, or let me say arthritis is used or is abused. Let me say it's abused. It's accused in situations where it has done nothing. Okay. So the fact that you have got bone-related problems does not mean at all automatically it is arthritis.
Okay.
It may well be arthritis.
Sure.
And even in arthritis, what type of arthritis it is, we'll be able to tell you that. But if it is not arthritis, we will tell you. So bone sarcoma, therefore, does affect a lot of people, and they are not even aware that they're suffering from bone sarcoma.
Absolutely.
They think it's arthritis, and they get all the injections, and they say I responded initially, and then after some time, the pain just surpasses comes back again. Because until you sort out the tissue of the bone,
the real problem,
you won't fix. You won't come right. Even in the tissues, like I said, the tissues are different. When it is the scleroderma, it's a different tissue. It's the connective tissue. So you must sort out the connective tissue. When it is sarcoma, it's a different tissue. So you must sort out the tissue. Okay. So so I cannot stress more that you have to know what is the cause in each case.
Absolutely. And then how to treat it, of course.
Then you will know how to treat it. That's the first part. If you know what is the cause, you're already halfway towards getting right in fixing that problem. But if you don't know, Carol, you keep searching, shooting in the dark.
Absolutely. Tembi, I think give us a few more symptoms. I know we've covered a bit of it now, but what do people need to look out for? What are some of the primary symptoms of the sarcoma, the bone sarcoma?
Okay. Firstly, sarcoma causes a lot of lumping, Carol.
Okay.
It causes.
Is this now the one in the soft tissue?
And remember, it's a soft tissue, but it's just that it's different tissues, whether it's bone or it's gastric or it's soft. So it causes, because even in the bones, you find a problem. We'll say my bone, or maybe at the joint, I see
at the joint, or?
a lump, and they think it's a bone, it's the bone extension. Because remember, when you've got arthritis and the bone, the cartilage is finished, you find the bones will actually end up causing maybe bursitis, when they, So, but it causes a lot of lumping. And you'll find that maybe you may notice a lump, maybe it will appear on the arm, and it will go. And in most cases, it's not painful.
Okay.
And then you find it will go. Or then you'll notice it somewhere else, but you'll find that lumping will be a common thing that appears.
And they can appear anywhere?
Anywhere,
on
internally or externally.
Oh, wow.
Now, I'll just give you two classical cases.
Okay, that was my next port of call.
No, before I even come to the examples,
okay.
I'm just giving two classical symptoms.
Okay.
Of people that has had sarcoma and ended up with these types of symptoms. Now, one told me that, she's diagnosed as having a renal failure. Okay, she was diagnosed as having a renal failure. So I scanned her and I picked up a number of things, But the interesting thing when she said to me is that I've been having a problem of urine blockage. And I think the diagnosis ended up, it emerged from the urine blockage. Okay.
So when you say blockage now, did she have problems?
She could not urinate.
Okay.
Yeah, she could not urinate.
Okay.
And now she says, lately I've been urinating so nicely. I've been urinating so nicely. And she does not know what caused her to be able to urinate just like that.
Was she on no medications?
On her own. She's dialyzing.
She's having dialysis?
She's attending those sessions.
But she was on no further medication that would have maybe treated the lumps. So these lumps were appearing.
No, nobody picked up the lumps.
Oh, wow.
Nobody picked up the lumps.
Only the difficulty in urinating.
The difficulty was all the diagnosis was that renal failure.
Okay.
And difficulty in urinating.
Okay.
But recently she just experienced this ability.
Wow.
And she was excited. Now I say to her, even though I'd never treated her, I've just come into the picture just lately. I'm only going to start treating. I said to her, let me tell you what possibly caused the blockage and for you to automatically urinate on your own. Mm-hmm. Sarcoma causes lumping. Now, if the lump, because your urinary system is compromised, and even though they had only diagnosed the kidneys, but I picked up the problem with the bladder. Okay. Mm-hmm. Now, I said to her, if you had lumps in your bladder and they happen to obstruct the urethra, the outlet, mm-hmm. you would not urinate.
Wow.
You would have obstructions. You
Absolutely.
would have problems depending on where it sits. But because the sarcoma lumping comes and goes, so when it has gone, you probably wonder,
oh wow,
how did it happen that I'm just urinating? Because
Absolutely.
That's what it does. The
Yes.
lumping may come and go and come and go, So that was one case. The other case was someone who asked me that at some stage she just became blind, completely blind, and there was no explanation for the cause.
Wow.
And then on her own, the eyes just managed to...
The vision just restored.
It just came back, And again, nobody knew where did it go and where is it coming from.
Yeah.
Sarcoma. Because if the lumping happens to sit and obstruct, the flow, you will become blind. Then once it has moved, then you wonder, what happened? So it does that. It causes a lot of lumping. Okay. So that's one area where once you start noticing lumps on and off, whether they're painful, they may be painful sometimes, they may not be painful other times, but they come and go. Once they stay there and they stay, it's because it has progressed a bit further. That's the first. One other thing that people should be on the lookout for. Once you have a tendency to feel tired, physically tired, remember there are many things that causes tiredness or fatigue. But when you feel, once you get too tired, once you've become physical, whether you've worked or you've tried to exercise but you find if you do, and it's such that people that have got sarcoma or even other tissue related conditions like lupus, you find they are regarded as being lazy.
Oh, wow.
You'll find that children at school that have got sarcoma, you find they only want to play chess. Because they sit down and just move the dust. They don't want to run or tennis or any other thing. Because those muscles cannot handle the condition. Or if you notice that your muscles are becoming flabby.
Okay.
You exercising.
The muscle tone is gone,
and it just leaves, on its own. You just you notice that, hey, why am I
losing muscle tone?
You're losing muscle tone.
I've heard people say that.
You of course there are other things that may cause that, but sarcoma is also one of them. The flap, because it's a tissue, it's a muscle related condition. So those are the three main ones that I can suggest just at the top of my head that people should, once you start having those, start finding out. Yeah. Could it be? Could it not be?
Absolutely. Wow. Thembi, I know that we asked for symptoms. Do you have 2 cases that you can tell us more about with the sarcoma?
Yeah. Yes.
More example cases that you've treated.
Yes. Like I always say, I've treated and I'm still treating.
Absolutely.
Yeah, I'm still treating. But I can just give the one that excites me is of a young man. It's a recent one. I think it's towards the end of last year, one that I started working on. And this young man had a tumor that was removed surgically by the doctors. It grew back again. And then they removed it for the second time and it grew back again. They did not know what caused the tumor. And they could not label it, but they saw that it is the tumor. Okay. And they did not even say cancer, because remember, sarcoma is a tissue cancer. In most cases, they battle to detect it as cancer. Because you find when the scan, because the properties of sarcoma, because you have to look at the tissue, you have to skim through, and look at the tissue. So if maybe you look at the whole organ, or you won't pick it up, but you've got to actually specifically observe the tissues in order to be able to pick it up. So he came to me when it was the third one, third tumor, and that was supposed to be removed again. And he was already having symptoms, like he had no balance, because it was sitting on the temporal lobe. He had no balance, and a bit of tremor that he was having. And when I saw him, immediately I saw that it was brain sarcoma. Okay, and the tumor was there. That's why he was losing the balance. It was also because it was located in an area, in a lobe that regulates the sound and the balance, I put him on the treatment program, and that shrunk that tumor completely. That there was no need for him to have the surgery. He ended up, the balance was restored, back, and he went back to work. The second one was a skin issue. The sarcoma was actually, the skin was like a lizard.
Oh wow!
With all the lumping, but it was
scarring too from the lumps.
And mostly the lower, the abdominal area, the lower limbs. So such that the person was scared to even put on anything that would reveal it. That would reveal it. She had to be in bands all the time, you know. So and the lumping in some cases would crack and ooze, you know, even though the ooze, because that's the other thing that she asked me, that what causes it to ooze, you know, because she didn't even know what is it, that slimy juice that was oozing out of her skin, what was causing it. Now the oozing was actually the lymph fluid.
Absolutely. I remember 2 shows ago we were talking about that exact same fluid.
Yeah. The oozing, because remember the lymph fluid is directly under the skin. So it's very close to the skin. But also the sarcoma damages the epithelial cells. Now the epithelial cells are responsible for keeping the moisture inside the body so that you don't lose it.
Precisely.
But now because she had the epithelial sarcoma, that is now the skin sarcoma, that damaged the epithelial cells. So the lymph fluid was oozing because the epithelial cells could not keep it inside. So that's why she saw all that oozing that was happening. So even though they said, no, it's allergy, because that's what they said, no, it's allergy. And then sometimes it would be psoriasis. The next thing it would be allergy. So they gave all sorts of diagnosis. Meanwhile, it was clearly sarcoma. Okay. So there are many cases, Carol. There are many cases. So those are the two, there are many other serious ones. You know, there are others where I wish, I could even let people talk to the public.
Yeah.
It's a difficult one, because people, and we respect their privacy,
Absolutely.
you know, the confidentiality. So I just share about these cases because at least I don't mention names.
They can stay anonymous.
It's just it's more for people to understand what kind of cases we deal with. But there are cases where you wish, you know, people could actually be the before and after, where people have got really terrible
Serious,
looking, visual things that you can refer to, where you would love for people to see how they look, and then once you've treated them, you would love for them to see the remarkable, you know.
Absolutely.
But we cannot.
No.
People are entitled to their privacy. So the best I can do is just to talk about,
share the stories with our
about
clients.
those cases.
Jamie, I've listened to all that you said now. What message would you send to our clients of what to look out for in sarcoma so that they can actually have it treated before it gets to such a serious, dangerous level?
Yeah.
What would you say would be the thing they need to look out for?
Yeah.
So it can be treated early?
You know, one thing that I am encouraging people to do across the country is come and let us check if you are deficient on the enzyme and bring your children.
Absolutely.
Because the children, you find, like I always say, because some people would ask me and say, when you say I am deficient on this enzyme and it comes with my chromosomes, it comes with my genes, how come that it only affects me now? People ask me such questions, and that's a legitimate question.
Absolutely.
You know?
Yeah.
Now, this is what I make people understand, that when we are deficient on an enzyme, you'll find it differs from one person to the other. Others start having problems as babies. They're born. The moment they start getting solids, they just get sick. You know, so sick. Others, when they start preschool, particularly, you know, those that start preschool, I've had quite a few parents saying in Xhosa, walamile. You know, when a person alamile, it means you must have seen something that your eyes were not supposed to see. Because once you see that, then it's definitely going to affect you. You know, like people, you know, we've got that in our culture, that there are certain things that you shouldn't look at and should not look at you. Okay. Because if that happens, then you are never going to come right. The skin is going to be terrible. You're going to have feet and all that. So people, I've had a few cases saying, hi, Lomdana, be right. Walamil, you know, because this child has been okay all along, and then all of a sudden she has seizures, or the skin just ruptures into, you know, chest problems and all that. Now she's forced to take that apple even if she doesn't like, because that's the rule. Then you find all of a sudden what happened. Then this child all of a sudden gets sick. I mean, there is one case that hurt me so much. And this lady, the young lady said, my child just had a shortness of breath, and she was taken to hospital, and they tried to check everything. They could not establish what was wrong, and she died.
Oh, wow.
And she died. She said, I haven't gotten over that, because I wish I could know what caused that.
Absolutely.
That child to suddenly die. Exactly. Like if someone has got cystic fibrosis, and this is what I tell, the thickening of the phlegm, and maybe that child was born with cystic fibrosis and is also deficient, and as she starts school, and then she starts eating all these things, and the system starts pushing the mucus, because she was already predisposed because of her genetic mutation or whatever. And then all of a sudden that mucus was thickening and thickening and thickening, and then it just,
wow.
And you can't breathe, you can't do nothing, because to be able to clear the phlegm and the thickening of the mucus when you've got cystic fibrosis, conventional as they do suction. They actually suck it out, you know?
Yeah.
But meanwhile, there's treatment so that can melt and decongest that phlegm. So what I'm getting at is coming back to what can people do? The first thing that you can do for yourself, have yourself tested to see if you're deficient on the enzyme. And you cannot just say, I'm going to stop eating fruit. Because if you are not deficient, you've got to have that fruit.
Your body needs it.
Your body needs that fruit. So you can't just say, because I see that fruit is causing, fruit is not causing problems, it's the enzyme that is causing problems.
Precisely, the lack of.
So if you have the enzyme, you must have fruit.
Sure.
If you don't have the enzyme, stay away from fruit.
Absolutely.
So that's why you need to start at. That's what I always advise people, that come so we can test where you stand and bring your children with. Because once you start helping your children while they are young,
yes,
save them.
Absolutely.
Then they're not going to have health issues, because the enzyme deficiency does not mean you are sick.
No, correct.
It just means you cannot process this type of fruit.
That particular fruit, yeah.
So if you stay away from that particular fruit, then you are safe.
Yeah. Okay.
Then you are
Does
safe.
the same apply to with the gluten and the lactose as well?
Exactly.
Okay.
So that is the best, because even if I were to say sarcoma, it's not just the sarcoma that affects people.
Yeah.
There's a whole range of illnesses
Sure.
that ends up affecting people just because they are deficient on these enzymes. So you've got to come and find out if your dietitian can be able to do that. You can go to them, or
Sure.
your doctor can be able to detect if you are fructose intolerant or gluten or lactose. Most of people come to me saying, I'm already aware I am lactose and gluten.
Yes, but the fructose is normally quite a shocker.
It's a shocker. And what I normally say to the fructose is, you will find that, because some people say, I'm a blood type so and so.
Yes.
And according to my blood type, I know I'm not supposed to have milk or dairy or gluten. But fruit does not feature, you know. And some say it does feature sometimes, but it just mentions the watermelon. It does not mention other fruits.
Sure.
This is what I tell people, that the blood type is the starting point.
Yeah.
It gives invaluable information, but that's just the starting point.
Sure.
Because you've got genetic areas that have got nothing to do with the blood type, that you are inheriting from your genealogy, you
Exactly.
know, which make you, because you might find you may be the same blood type, but you may not be deficient on the enzyme because you don't come from a family that's got that. Me, I may be, and therefore I cannot take fruit, even though in the list of foods that I can have according to my blood type,
It says fruit.
I should be having. The other thing that I normally say is the case of iron overload.
Yeah.
Because when you're iron overloaded, you cannot have red meat. You know, or spinach, or you know, those
Anything rich
heavy.
in iron.
And then they say, according to my blood type, I'm a meat eater. I'm supposed to have
I've
meat.
heard that too many times, yeah.
There also, if you're iron overloaded, it's got nothing to do with, it doesn't care if you've got blood type. If you're iron overloaded, Even if
Exactly.
you are a meat eater, you're supposed to stay away from red meat.
Yeah, predominantly red.
Predominantly red meat. So what I'm saying there for Carol is that the blood type just gives
The indication?
the basis.
Yeah.
The springboard.
Yeah.
After that, you look at so many other factors, like your genetic factors, environmental factors. You look at a whole lot of other things, which is why you find when we give people treatment, we also give them a booklet that says you can eat this, or you can stay away from that, according to what we have picked up.
According to their own instruction manual for their body.
According to your own instruction manual.
Absolutely.
So I don't want to specify and say look for lumps or what.
Yeah.
Because there it's already indicating.
Yes.
But you'll find there are people who will not even have indicators. Because even if you feel tired most of the time, there are many other causes for that. So my best bet or suggestion to people, come let us test to see if you are okay for that enzyme and other related.
That's a good starting
enzymes.
point, I think.
That's the starting
Absolutely.
point I can suggest.
I think it's quite a valuable lesson, because I think there's so many people out there that are suffering with conditions and they have no idea of which enzymes they have or don't have or what food they can process.
Exactly.
So as a starting point, I think that's a good one for us today. Thank you so much, Thembi.
You're welcome.
Our Gauteng visits have taken off very well. We would just like to thank you for your ongoing support. We intend on opening up a branch very soon. For further bookings, please call us on 041 484 1555, or you can send us an email at info@healthhaven.co.za.
Welcome back. I've had quite a few people complaining about us not responding to some of your emails. So I thought today I will try and squeeze in just 2 questions. And I've got Kelly that is going to ask me the questions. Hi, Kelly.
Hi, Thames. The first question, I would like to find out what are the medical disadvantages and advantages of an enema, also known in Xhosa as u'ucima.
Okay, good to you, ma. All right, no, you've got that right. I suppose most people, particularly black people, know what it means, ukucima. Ukucima is, well, I don't have to explain it. My assumption is that people know what it is. Look, when you've got a problem of constipation, ukucima is something that most people use because they've got a problem of constipation. If you are okay, let me start by saying this. The stools are not meant to sit in the colon. The stools are meant to be eliminated. The colon is just a passage that must excrete the accumulation of the feces. Okay. But now, if you are constipated for whatever reason, and in most cases it's because of dietary reasons or liver-related conditions. So there are many causes for constipation. But if you have to use enema, at least it is better to use that so that you can at least excrete the toxic build-up or the fecal build-up in your colon than to sit with it. Ukucima or enema is not the solution, but it is a temporary solution if you are really constipated and you need to relieve the stools or to relieve your colon from too much build-up.
I was pregnant in 2012 and I gave birth to a stillborn, which the sister said the baby had died 5 days before. I've since then been having abdominal pains and I'm not using contraceptive. I'm not getting pregnant and I want to know if there are any chances of not getting pregnant. I have been going to the doctors, but they only say it's an infection.
There is no way that the stillborn that she had in 2012 could still be the cause for abdominal pains that she had today. In fact, could be the cause for abdominal pain anyway. Okay. Now, remember, firstly, what caused the stillborn. Of course, she doesn't say what they said was the cause, but in most cases, people who end up having stillborn, although I don't know how far she was in her pregnancy, people who end up having miscarriages, because that's what it said, when the baby is still too young, when the fetus is still too young, you're miscarrying. But when the baby is almost full, and almost ready for birth, then they call it a stillborn. But now my assumption is that maybe the pregnancy was quite advanced. Maybe she was on her almost third term. The most common cause for conditions like that, where you find a person has a stillborn, is something called preeclampsia, where you find a person develops what we call gestation high blood pressure or even diabetes, and ends up maybe having quite a bit of of protein in her urine. So firstly, I think that must have been the reason. But you'll find also when you are gluten and lactose and even fructose intolerant, besides the fact that you might have complications of blood pressure in your pregnancy, you might also battle to fall pregnant. I've had quite a few cases of people who could not fall pregnant, but even if they do, they would miscarry all the time because of celiac disease or gluten and lactose intolerant, and even worse with fructose intolerant. But now, the abdominal pain can mean a number of things. It doesn't mean when you've got abdominal pain, it's necessarily uterine related. You may have abdominal pain and yet it's the bladder. Like a bladder interstitial cystitis, you might have abdominal pain. Or you might have, like we were talking about sarcoma, for instance, earlier on, you might even have uterine sarcoma. I've had cases of young people with uterine sarcoma. Or you might even have uterine lymphoma, because those particular conditions you find the conventional medical profession battles to detect. They easily detect uterine cancer because they do pap smear. But sarcoma and lymphoma, they will battle to detect by just doing pap smear. So the abdominal pain, therefore, you can't tell if it's the bladder, you can't tell if it's the uterus, and you can't tell if it is the uterus what is causing that. But my gut is that the very thing that caused you to miscarry may be related to a number of things. So my suggestion would be, wherever you are, when you get a chance to come to us, we will be able to tell you exactly what causes that abdominal pain and what actually even caused you to have a miscarriage or a stillborn and makes you battle to fall pregnant. And once we have identified what the cause is, we will be able to tell you if you will be able to fall pregnant or not. Okay?
Thanks, Thames.
All right. Thank you, Kelly. Many people that we work with and that we bump on ask us, where have we been all along? And where do we get all this information? Where does information come from? The information has been there all along. Let me just ask you a question. If you come in a dark room and you do not see the person that is sitting there, does that mean he is not there? Definitely not. It is just that you can't see him. That goes for information as well. The information and knowledge is provided by the universe. We are all students, and that includes doctors and professors as well. When the student is ready, therefore, the universe presents the teacher. We are simply falling in that bigger scheme of the higher order, because the time is right. Because you are now ready to listen, you are ready to learn. The credit, therefore, goes to you because you are now ready to embrace the information that the universe is passing on to you through us. God bless you all, and goodbye.